Hi, welcome to today's video. Today we are going to discuss staff nurse previous question papers with explanations. So hope everybody will learn and study and please watch the full video. So we will see question number 1. A 40-year-old a 43-year-old African American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? Options are body temperature of 99 degree Fahrenheit or less, toes moved in active range of motion, sensation reported when soles of feet are touched, capillary refill of less than 3. So the correct answer is option D. Capillary refill of less than 3. It is important to assess the extremities for blood vessel occlusion in the client with sickle cell anemia because a change in capillary refill would indicate a change in circulation. Body temperature, motion, and sensation would not give information regarding peripheral circulation. Therefore, answers A, B, and C are incorrect. Question number 2. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? Options are side lying with knees flexed, knee chest, high fowlers with knees flexed, semi fowlers with legs extended on the bed. So a patient brought to the emergency department with a sickle cell crisis. Which position we will give? Correct answer is option D. Semi-fowlers with legs extended on the bed. Explanation we will see. Placing the client in semi-fowlers position provides the best oxygenation for this client. Flexion of the hips and knees, which includes the knee chest position, impedes circulation and is not correct positioning for this client. Question number 3. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Options are taking hourly blood pressures with a mechanical cuff, encouraging fluid intake of at least 200 ml per hour, position in high fowlers with knee gauge raised, administering Tylenol as ordered. Correct answer option B. Encouraging fluid intake of at least 200 ml per hour. We will see the explanation. It is important to keep the client in sickle cell crisis hydrated to prevent further sickling of the blood. Answer A is incorrect because a mechanical cuff places too much pressure on the arm. Answer C is incorrect because raising the knee gauge impedes circulation. Answer D is incorrect because Tylenol is too mild and analgesic for the client in crisis. Question number 4. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Options are steak, cottage cheese, popsicle, lima beans. Correct answer option C, popsicle. Explanation. Hydration is important in the client with sickle cell disease to prevent thrombus formation. Pepsicles, gelatin, juice, and pudding have a high fluid content. The foods in answers A, B, and D do not aid in hydration. Question number 5. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? Options are adjust the room temperature, give a bolus of IV fluid, start O2, administer meperidine demerol 75 mg IV push. Correct answer option C, start O2. Explanation. The pulse oximetry indicates that oxygen levels are low, thus oxygenation takes precedence over pain relief. Answer A is incorrect because although a warm environment reduces pain and minimizes sickling, it would not be a priority. Answer B is incorrect because although hydration is important, it would not require a bolus. Answer D is incorrect because demerol is acidifying to the blood and increases sickling. Question number 6. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? Options are roast beef, gelatin salad, green peas and a peach pie, chicken salad sandwich, coleslaw, french fries, ice cream, egg salad on wheat bread, carrot sticks, lettuce, salad, rice in pie, pork chop, creamed potatoes, corn, and coconut cake. Correct answer option C. Egg salad on wheat bread, carrot sticks, lettuce, salad, and rice in pie. Explanation: egg yolks, wheat bread, carrots, raisins, and green leafy vegetables are all high in iron, which is an important mineral for this client. Roast beef, cabbage, and pork chops are also high in iron, but the side dishes accompanying these choices are not. Therefore, answers A, B, and D are incorrect. Question number 7. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? Options are a family vacation in the Rocky Mountain, chaperoning the local boys club on a snow skiing trip, traveling by airplane for business trips, a bus trip to the Museum of Natural History. Correct answer option D. A bus trip to the Museum of Natural History. Explanation: taking a trip to the museum is the only answer that does not pose a threat. A family vacation in the Rocky Mountains at high altitudes, cold temperatures, and airplane travel can cause sickling episodes and should be avoided. Therefore, answers A, B, and C are incorrect. Question number 8. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? Options are enlarged spleen, elevated blood pressure, bradycardia, beefy tongue. Correct answer option D, beefy tongue. Explanation: the tongue of the client with B12 insufficiency is red and beefy. Answers A, B, and C incorrect because enlarged spleen, elevated BP, and bradycardia are not associated with B12 deficiency. Question number 9. The body part that would most likely display jaundice in the dark-skinned individual is. Options are the conjunctiva of the eye, the soles of the feet, the roof of the mouth, shins. Correct answer option C, roof of the mouth. Explanation: the oral mucosa and hard palate, roof of the mouth are the best indicators of jaundice in dark-skinned person. The conjunctiva can have normal deposits of fat which give a yellowish hue. Thus, answer A is incorrect. The soles of the feet can be yellow if they are calloused, making answer B incorrect. The shins would be an area of darker pigment, so answer D is incorrect. Question number 10. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Options are BP 146 by 88, respiration 28 shallow, weight gain of 10 pounds in 6 months, pink complexion. Correct answer option B, respiration 28 breaths per minute. Explanation: when there are fewer red blood cells, there is less hemoglobin and less oxygen. Therefore, the client is often short of breath as indicated in answer B. The client with anemia is often pale in color, has weight loss, and may be hypotensive. Answers A, C, and D are within normal and therefore are incorrect. Question number 11. The nurse is teaching the client with polycythemia vera about prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? Options are: I will drink 500 ml of fluid or less each day. I will wear support hose. I will check my blood pressure regularly. I will report ankle edema. Correct answer is option A. That is, I will drink 500 ml of fluid or less each day. Explanation: the client with polycythemia vera is at risk for thrombus formation. Hydrating the client with at least 3 liters of fluid per day is important in preventing clot formation. So, the statement to drink less than 500 ml is incorrect. Answers B, C, and D are incorrect because they all contribute to the prevention of complications. Support hose promotes venous return. The electric razor prevents bleeding due to injury, and a diet low in iron is essential to preventing further red cell formation. Question number 12. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? Options are: the client collects stamps as a hobby, the client recently lost his job as a postal worker, the client had radiation for treatment of Hodgkin's disease as a teenager, the client's brother had leukemia as a child. Correct answer option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Explanation: radiation treatment for other types of cancer can contribute to the development of leukemia. Some hobbies and occupations involving chemicals are linked to leukemia but not the ones in these answers. Therefore, answers A and B are incorrect. Answer D is incorrect because the incidence of leukemia is higher in twins, not siblings. Question number 13. Where is the best site for examining for the presence of petechiae in an African American client? Options are the abdomen, the thorax, the earlobes, the soles of the feet. Correct answer option D, the soles of the feet. The petechiae are not usually visualized on dark skin. The soles of the feet and palms of the hand provide a lighter surface for assessing the client for petechiae. Answers A, B, and C are incorrect because the skin may be too dark to make an assessment. Question number 14. The client is being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? Options are: have you noticed a change in sleeping habits recently? Have you had a respiratory infection in the last 6 months? Have you lost weight recently? Have you noticed changes in your alertness? Correct answer option B. Have you had a respiratory infection in the last 6 months? Explanation: the client with leukemia is at risk for infection and has often had recurrent respiratory infections during the previous 6 months. Insomnolence, weight loss, and a decrease in alertness also occur in leukemia, but bleeding tendencies and infections are the primary clinical manifestations. Therefore, answers A, C, and D are incorrect. Question number 15. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Options are: oral mucous membrane altered related to chemotherapy, risk for injury related to thrombocytopenia, fatigue related to disease process, interrupted family processes related to life-threatening illness of a family member. Correct answer option B, risk for injury related to thrombocytopenia. Explanation: the client with acute leukemia has bleeding tendency due to decreased platelet counts and any injury would exacerbate the problem. The client would require close monitoring for hemorrhage, which is of higher priority than the diagnosis in answers A, C, and D, which are incorrect. Question number 16. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? Options are sexual dysfunction related to radiation therapy, anticipatory grieving related to terminal illness, tissue integrity related to prolonged bed rest, fatigue related to chemotherapy. Correct answer option A, sexual dysfunction related to radiation therapy. Explanation: radiation therapy often causes sterility in male clients and would be of primary importance to this client. The psychosocial needs of the client are important to address in light of the age and life choices. Hodgkin's disease, however, has a good prognosis when diagnosed early. Answers B, C, and D are incorrect because they are of lesser priority. Question number 17. A client has autoimmune thrombocytopenia purpura. To determine the client's responses to the treatment, the nurse would monitor. Options are platelet count, white blood cell count, potassium levels, partial prothrombin time. Correct answer option A, platelet count. Explanation: clients with autoimmune thrombocytopenic purpura (ATP) have low platelet counts, making answer A the correct answer. White cell counts, potassium levels, and PTT are not affected in ATP. Thus, answers B, C, and D are incorrect. Question number 18. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura. The client's platelet count currently is 80,000. It will be most important to teach the client and family about options are bleeding precaution, prevention of falls, oxygen therapy, conservation of energy. Correct answer option A, bleeding precautions. Explanation: the normal platelet count is 1,20,000 to 4 lakh. Bleeding occurs in clients with low platelets. The priority is to prevent and minimize bleeding. Oxygenation is answer C is important, but platelets do not carry oxygen. Answers B and D are of lesser priority and are incorrect in this instance. Question number 19. The client has surgery for removal of a prolactinoma. Which of the following interventions would be appropriate for this client? Options are place the client in Trendelenburg position for postural drainage, encourage coughing and deep breathing every 2 hours, elevate the head of the bed 30 degree, encourage the Valsalva maneuver for bowel. Correct answer option C, elevate the head of the bed 30 degree. Explanation: a prolactinoma is a type of pituitary tumor. Elevating the head of the bed 30 degree avoids pressure on the sella turcica and helps to prevent headache. Answers A, B, and D are incorrect because Trendelenburg-Valsalva maneuver and coughing all increases the intracranial pressure. Question number 20. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is options are measure the urinary output, check the vitals, encourage increased fluid intake, weigh the client. Correct answer option B, check the vital signs. Explanation: the large amount of fluid loss can cause fluid and electrolyte imbalance that should be corrected. The loss of electrolytes would be reflected in the vitals. Measuring the urinary output is important, but the stem already says that the client has polyuria, so answer A is incorrect. Encouraging fluid intake will not correct the problem, making answer C. Incorrect. Answer C incorrect. Answer D is incorrect because weighing the client is not necessary at this time. Question number 21. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? Options are: place the client in a sitting position, administer acetaminophen Tylenol, pinch the soft lower part of the nose, apply ice pack to the forehead. Correct answer option C. Pinch the soft lower part of the nose. Explanation: C is correct because direct pressure to the nose stop the bleeding. Answer A, B and D are incorrect because they do not stop bleeding. Question number 22. A client has had a unilateral adrenalectomy to remove a tumor. The most important measurement in the immediate postoperative period for the nurse to take is: options are the blood pressure, the temperature, the urinary output, the specific gravity of the urine. Correct answer option A, the blood pressure. Explanation: blood pressure is the best indicator of cardiovascular collapse in the client who has had an adrenal gland removed. The remaining gland might have been suppressed due to the tumor activity. Temperature would be an indicator of infection. Decreased output would be a clinical manifestation, but would take longer to occur than blood pressure changes, and specific gravity changes occur with other disorders. Therefore, answers B, C, and D are incorrect. Question number 23. A client with Addison disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving IV glucocorticoid. Which of the following interventions would the nurse implement? Options are: glucometer reading as ordered, intake output measurements. Correct answer option A, glucometer reading as ordered. Explanation: IV glucocorticoids raise the glucose levels and often require coverage with insulin. Answer B is not necessary at this time. Sodium and potassium levels would be monitored when the client is receiving mineral corticoids and daily weight is unnecessary. Therefore, answers B, C, and D are incorrect. Question number 24. A client had a total thyroidectomy yesterday. A client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? Options are: obtain a crash cart, check the calcium level, assess the dressing for drainage, assess the blood pressure for hypertension. Correct answer option B, check the calcium level. Explanation: the parathyroid glands are responsible for calcium production and can be damaged during a thyroidectomy. The tingling can be due to low calcium levels. The crash cart would be needed in respiratory distress but would not be the next action to take. Thus, answer A is incorrect. Hypertension occurs in thyroid storm and the drainage would occur in hemorrhage. So, answer C, D are incorrect. Question number 25. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52. There is a weight gain of 30 pounds in 4 months and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnosis is of highest priority? Options are: impaired physical mobility related to decreased endurance. Option B, hypothermia related to decreased metabolic rate. Option C, disturbed thought process related to interstitial edema. Option D, decreased cardiac output related to bradycardia. Correct answer option D, decreased cardiac output related to bradycardia. Explanation: the decrease in pulse can affect the cardiac output and lead to shock, which would take precedence over the other choices. Therefore, answers A, B, and C are incorrect. Question number 26. The client presents to the clinic with a serum cholesterol of 275 mg per dl and is placed on rosuvastatin. Which instruction should be given to the client taking rosuvastatin? Options are report muscle weakness to the physician, allow 6 months for the drug to take effect, take the medication with fruit juice. Correct answer option A. Report muscle weakness to the physician. Explanation. The client is taking anti-lipidemics should be encouraged to report muscle weakness because this is a sign of rhabdomyolysis. The medication takes effect within 1 month of beginning therapy, so answer B is incorrect. The medication should be taken with water because of fruit juice, particularly grapefruit, can decrease the effectiveness, making answer C is incorrect. Liver function studies should be checked before beginning the medication, not after the fact, making answer D is incorrect. Question number 27. The client is admitted to the hospital with hypertensive crisis. Diazoxide is ordered during administration. The nurse should, options are, utilize an infusion pump, check the blood glucose level, place the client in Trelleborg position, cover the solution with foil. Correct answer option B, check the blood glucose level. Explanation. Hyperstat is given IV push for hypertensive crisis, but it often causes hyperglycemia. The glucose level will drop rapidly when stopped. Answer A is incorrect because the hyperstat is given by IV push. The client should be placed in dorsal recommend position, not Trelleborg position as stated in answer C. Answer D is incorrect because the medication does not have to be covered with foil. Question number 28. The 6 months old client with a ventral septal defect is receiving digitalis for regulation of his heart rate. Which finding should be reported to the doctor? Options are blood pressure of 126 by 80, blood glucose of 110 mg per dl, heart rate of 60 beats per minute, respiratory rate of 30 breaths per minute. Correct answer option C, heart rate of 60 beats per minute. Explanation. A heart rate of 60 in the baby should be reported immediately. The dose should be held if the heart rate is below 100 beats per minute. The blood glucose, blood pressure and respirations are within normal limits. Thus answers A, B and D are incorrect. Question number 29. The client admitted with angina is given a prescription for nitroglycerin. The client should be instructed to, options are, replenish his supply every 3 months, take one every 15 minutes if pain occurs, leave the medication in the brown bottle, crush the medication and take with water. Correct answer option C, leave the medication in the brown bottle. Explanation. Nitroglycerin should be kept in a brown bottle or even a special air and watertight solid or plated silver or gold container because of its instability and tendency to become less potent when exposed to air, light or water. The supply should be replenished every 6 months, not 3 months, and one tablet should be taken every 5 minutes until pain subsides. So answers A and B are incorrect. If the pain does not subside, the client should report it to the emergency room. The medication should be taken sublingually and should not be crushed, as stated in answer D. Question number 30. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Options are macaroni and cheese, shrimp with rice, turkey breast, spaghetti with meat sauce. Correct answer option C, turkey breast. Explanation. Turkey contains the least amount of fat and cholesterol. Liver, eggs, beef, cream sauce, shrimp, cheese, and chocolate should be avoided by the client. Thus, answers A, B, and D are incorrect. The client should take meat rather than frying to avoid adding fat to the meat during cooking. Question number 31. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, the nurse should check the options are feet, neck, hands, sacrum. Correct answer option B, neck. Explanation. The jugular veins in the neck should be assessed for distension. The other parts of the body will be edematous in right-sided congestive heart failure, not left-sided. Thus, answers A, C and D are incorrect. Question number 32. The nurse is checking the client's central venous pressure. The nurse should place the zero of the manometer at the options are phlebostatic axis, PMI, Eppes point, tail of Spence. Correct answer option A, phlebostatic axis. Explanation. The phlebostatic axis is located at the fifth intercostal space mid-axillary line and is the correct placement of the manometer. The PMI or point of maximal impulse is located at the fifth intercostal space mid-clavicular line, so answer B is incorrect. Eppes point is the point at which you can hear the valves close simultaneously, making answer C incorrect. The tail of Spence, the upper outer quadrant of the breast, is the area where most breast cancers are located and has nothing to do with the placement of a manometer. Thus, answer D is incorrect. Question number 33. The physician orders lisinopril and furosemide to be administered concomitantly to the client with hypertension. The nurse should, options are, question the order, administer the medication, administer separately, contact the pharmacy. Correct answer option B, administer the medication. Explanation. Cestrel is an ACE inhibitor and is frequently given with a diuretic such as Lasix for hypertension. Answers A, C and D are incorrect because the order is accurate. There is no need to question the order, administer the medication separately or contact the pharmacy. Question number 34. The best method of evaluating the amount of peripheral edema is, options are weighing the client daily, measuring the extremity, measuring the intake and output, checking for pitting. Correct answer option B, measuring the extremity. Explanation. The best indicator of peripheral edema is measuring the extremity. A paper tape measure should be used rather than one made of plastic or cloth, and the area should be marked with a pen, providing the most objective assessment. Answer A is incorrect because weighing the client will not indicate peripheral edema. Answer C is incorrect because checking the intake and output will not indicate peripheral edema. Answer D is incorrect because checking for pitting edema is less reliable than measuring with a paper tape measure. Question number 35. A client with vaginal cancer is being treated with a radioactive vaginal implant. The client's husband asks the nurse if he can spend the night with his wife. The nurse should explain that options are overnight stays by family members is against hospital policy. There is no need for him to stay because staffing is adequate. His wife will rest much better knowing that he is at home. Correct answer option D. Option D is visitation is limited to 30 minutes when the implant is in place. Correct answer option D. Clients with radium implants should have close contact limited to 30 minutes per visit. The general rule is limiting time spent exposed to radium, putting distance between people and the radium source, and using light to shield against the radium. Teaching the family members these principles is extremely important. Answer A, B, and C are not empathetic and do not address the question, therefore, they are incorrect. Question number 36. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited to the client? Options are roast beef sandwich, potato chips, pickles, pear-iced tea, split pea soup, mashed potato, pudding and milk, tomato soup, cheese toast, jello coffee, hamburger, baked beans, fruit cup and iced tea. Correct answer option B. Split pea soup, mashed potato, pudding and milk. Explanation. The client with a facial stroke will have difficulty in swallowing and chewing, and the foods in answer B provide the least amount of chewing. The foods in answers A, C and D would require more chewing and thus are incorrect. Question number 37. The physician has prescribed Novalog insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? Options are I will make sure I eat breakfast within 10 minutes of taking my insulin. I will need to carry candy or some form of sugar with me all the time. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. Correct answer option A. I will make sure I eat breakfast within 10 minutes of taking my insulin. Explanation. A Novalog insulin onsets very quickly, so food should be available within 10 to 15 minutes of taking the insulin. Answer B does not address a particular type of insulin, so it is incorrect. NPH insulin peaks in 8 to 12 hours, so a snack should be eaten at the expected peak time. It may not be 3 p.m. as stated in answer C. Answer D is incorrect because there is no need to save the dessert until bedtime. Question number 38. The nurse is teaching basic infant care to a group of first time parents. The nurse should explain that a sponge bath is recommended for the first 2 weeks of life because options are new parents need time to learn how to hold the baby. The umbilical cord needs time to separate. Newborn skin is easily traumatized by washing. The chance of chilling the baby outweighs the benefits of bathing. Correct answer option B. The umbilical cord needs time to separate. Explanation. The umbilical cord needs time to dry and fall off before putting the infant in the tub. Although answers A, C, and D might be important, they are not the primary answer to the question. Question number 39. A client with leukemia is receiving trimethoprim. After reviewing the client's chart, the physician orders Velcovorin. The rationale for administering leucovorin calcium to a client receiving trimethoprim is to options are treat iron-deficiency anemia caused by chemotherapeutic agents, create a synergistic effect that shortens treatment time, increase the number of circulating neutrophils, reverse drug toxicity and prevents tissue damage. Correct answer option D. Reverse drug toxicity and prevents tissue damage. Explanation. Antagonist. Leucovorin is a folic acid derivative. Answers A, B and C are incorrect because leucovorin does not treat iron deficiency. increase neutrophils, or have a synergistic effect. Question number 40. A 4-month-old is brought to the well baby clinic for immunization. In addition to the DPT and polio vaccine, the baby should receive options are HIV titer, mumps vaccine, hepatitis B vaccine, MMR. Correct answer option A, HIV titer. Explanation. The Haemophilus influenza vaccine is given at 4 months with the polio vaccine. Answers B, C and D are incorrect because these vaccines are given later in life. Question number 41. The physician has prescribed Nexium esomeprazole for a client with erosive gastritis. The nurse should administer the medication. Options are 30 minutes before a meal, with each meal, in a single dose at bedtime, 30 minutes after meal. Correct answer option A, 30 minutes before a meal. Question number 42. A client on the psychiatric unit is in an uncontrolled rage and is threatening other clients and staff. What is the most appropriate action for the nurse to take? Options are call security for assistance and prepare to sedate the client. Tell the client to calm down and ask him if he would like to play cards. Tell the client that if he continues his behavior, he will be punished. Leave the client alone until he calms down. Correct answer option A. Call security for assistance and prepare to sedate the client. Explanation. If the client is a threat to the staff and to other clients, the nurse should call for help and prepare to administer a medication such as Haldol to sedate him. Answer B is incorrect because simply telling the client to calm down will not work. Answer C is incorrect because telling the client that if he continues he will be punished is a threat and may further anger him. Answer D is incorrect because if the client is left alone, he might harm himself. Question number 43. When the nurse checks the fundus of a client on the first postpartum day, she notes that the fundus is firm, is at the level of the umbilicus, and is displaced to the right. The next action the nurse should take is to options are check the client for bladder distension, assess the blood pressure for hypotension, determine whether an oxytocic drug was given, check for the expulsion of small clots. Correct answer option A. Check the client for bladder distension. Explanation. If the fundus of the client is displaced to the side, this might indicate a full bladder. The next action by the nurse should be to check for bladder distension and catheterize if necessary. The answers in B, C, and D are actions that are related to the postpartum hemorrhage. Question number 44. A client is admitted to the hospital with a temperature of 99.8 degree Fahrenheit, complaints of blood-tinged hemoptysis, fatigue and night sweats. The client's symptoms are consistent with a diagnosis of options are pneumonia, reaction to antiviral medication, tuberculosis, superinfection due to low CD4 count. Correct answer option C, tuberculosis. Explanation. A low-grade temperature, blood-tinged sputum, fatigue and night sweats are symptoms consistent with tuberculosis. If the answer in a hard set pneumocystis pneumonia, answer A would have been consistent with the symptoms given in the stem. But just saying pneumonia is not specific enough to diagnose the problem. Answers B and D are not directly related to the stem. Question number 45. The client is seen in the clinic for treatment of migraine headaches. The drug Imitrex is prescribed for the client. Which of the following in the client's history should be reported to the doctor? Options are diabetes, Prince-Metal's angina, cancer, cluster headaches. Correct answer option B. Prince-Metal's angina. Explanation. If the client has a history of Prince-Metal's angina, he should not be prescribed triptan preparations because they cause vasoconstriction and coronary spasm. There is no contraindication for taking triptan drugs in clients with diabetes, cancer, or cluster headaches, making answers A, C, and D incorrect. Question number 46. The client with suspected meningitis is admitted to the unit. The doctor is performing an assessment to determine meningeal irritation and spinal nerve root inflammation. A positive Kerning sign is charted if the nurse notes. Options are pain on flexion of the hip and knee, knuckle rigidity on flexion of the neck, pain when the head is turned to the left side, dizziness when changing position. Correct answer option A, pain on flexion of the hip and knee. Explanation. Kerning sign is positive if pain occurs on flexion of the hip and knee. The Bradycardia sign reflex is positive if pain occurs on flexion of the head and neck onto the chest. So answer B is incorrect. Answers C and D might be present but are not related to Kerning sign. Question number 47. The client with Alzheimer's disease is being assisted with activities of daily living when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting. Options are agnosia, apraxia, anomia, aphasia. Correct answer option B, apraxia. Explanation. Apraxia is the inability to use objects appropriately. Agnosia is loss of sensory comprehension. Anomia is the inability to find words. And aphasia is the inability to speak or understand. So answers A, C, and D are incorrect. Question number 48. The client with dementia is experiencing confusion late in the afternoon and before bedtime. The nurse is aware that the client is experiencing what is known as options are chronic fatigue syndrome, normal aging, sundowning, delusions. Correct answer option C, sundowning. Explanation. Increased confusion at night is known as sundowning syndrome. This increased confusion occurs when the sun begins to set and continues during the night. Answers A is incorrect because fatigue is not necessarily present. Increased confusion at night is not part of normal aging. Therefore, answer B is incorrect. A delusion is a firm fixed belief. Therefore, answer D is incorrect. Question number 49. The client with the confusion says to the nurse, I haven't had anything to eat all day long. When are they going to bring breakfast? The nurse saw the client in the day room eating breakfast with other clients 30 minutes before this conversation. This response would be best for the nurse to make. Options are you had a breakfast 30 minutes ago. I am so sorry that they didn't get you breakfast. I will report it to the charge nurse. I will get you some juice and toast. Would you like something else? You will have to wait a while. Lunch will be here in a little while. Correct answer option C. I will get you some juice and toast. Would you like something else? Explanation: the client who is confused might forget that he ate earlier. Don't argue with the client. Simply get him something to eat that will satisfy him until lunch. Answers A and D are incorrect because the nurse is dismissing the client. Answer B is validating the delusion. Question number 50. The doctor has prescribed Exelon, Exelon for the client with Alzheimer's disease. Which side effect is most often associated with this drug? Options are urinary incontinence, headache, confusion, nausea. Correct answer option D, nausea. Explanation: nausea and gastrointestinal upset are very common in clients taking acetylcholinesterase inhibitors such as Exelon. Other side effects include liver toxicity, dizziness, unsteadiness, and clumsiness. The client might already be experiencing urinary incontinence or headaches, but they are not necessarily associated, and the client with Alzheimer's disease is already confused. Therefore, answers A, B, and C are incorrect. Hope everybody understood these questions. Other questions will include in next video. If you are understanding or interested, please subscribe my channel. Press the bell icon also. Daily a lot of question papers and previous questions are including in my channel. Please go to the playlist and see all the questions. Subscribe and support me. Share to your friends also. Thank you for watching.